Let's take a look at a summary of trigger points involved with elbow pain. First, we have the supraspinatus trigger points, shown here in pink, that refer to the lateral elbow. Next, we have the triceps brachii trigger points, which can refer both to the lateral and medial elbow, as well as the olecranon process. Next, we have the pectoralis major trigger points, shown in yellow, which refer pain to the medial elbow. Now the supinator trigger points, shown here in orange, refer strong pain to the lateral elbow. And in green, the extensor carpi radialis longus trigger point, which refer pain to the lateral elbow as well. And the brachioradialis trigger point again refers pain to the lateral elbow. Associated symptoms for the supraspinatus trigger points are as follows. Clients will complain of deep ache and tenderness in the lateral deltoid region, sometimes extending down the arm and into the lateral epicondyle at the elbow. The pain is felt when they abduct their arm and may also be present at rest. Clients will also describe a snapping or clicking sound that's present during movement of their shoulder. Activities such as combing their hair, shaving, or brushing their teeth are usually restricted by pain. Activating and perpetuating factors for the supraspinatus trigger points include walking a large dog that pulls on the leash, carrying a heavy briefcase, and any task that requires repetitive or prolonged raising of the arm. Clinical findings for the triceps brachii trigger points. Clients with active trigger points in this muscle will complain of pain in the lateral epicondyle, medial epicondyle, posterior shoulder, posterior arm, and forearm regions. They are also likely to complain of vague or diffuse pain in the back of the shoulder and upper arm. They may also have tenderness at the medial epicondyle that may force the arm to be carried away from their body. Reaching above their head is going to be limited by pain or tension in the triceps area. Some activating and perpetuating factors for the triceps brachii trigger point include the use of crutches, playing tennis and other sports, and doing detailed handwork without elbow support, such as needlepoint. The clinical findings for the pectoralis major muscle are as follows. Clients will complain of chest pain, anterior shoulder pain, pain down the ulnar aspect of the forearm and into the fourth and fifth fingers, breast tenderness or nipple hypersensitivity. If the pain is on the left side of the chest and arm, it can easily be confused with cardiac pain. A lot of times when your client complains of chest pain, they will also complain of pain between the shoulder blades. Some activating and perpetuating factors for pectoralis major trigger points include the head forward rounded shoulder posture, heavy lifting with the arms out in front of the body, use of hedge clippers, immobilization of the arm, chilling of the pec major muscle, high levels of anxiety, and possibly pain from a previous heart attack. Associated symptoms for trigger points in the supinator muscle are as follows. Pain and tenderness in the lateral epicondyle, lateral elbow, and base of the thumb regions. and numbness in the thumb and tingling in the index finger. Activating and perpetuating factors for trigger points in the supinator muscle include playing tennis, walking a large dog on a leash, flipping a briefcase onto a desk, ironing, wringing out wet clothes, raking leaves, and holding a weed eater. Here are the clinical findings for brachioradialis trigger points. Clients may complain of pain that starts at the lateral epicondyle and moves down to the wrist and to the base of the thumb. The therapist can actually confirm the presence of an active trigger point in the brachioradialis by tapping on the lateral epicondyle and eliciting pain and tenderness. Your client may also complain of pronounced weakness of the grip, with objects frequently slipping out of their grasp. Some activating factors for brachioradialis trigger points include playing tennis, weeding with a trowel, prolonged frisbee throwing, ironing, and prolonged immobilization after a shoulder injury.